afternoon, state legislatures introducing a new set of bills today aiming to bring equity to birth outcomes in our state. This comes as federal health data just shows that African Americans experience 2.3 times infant mortality than they do white females. And the data is increasingly stark when you zoom in on the Milwaukee area. Andrea Albers has been following this announcement all morning and now joins us with the details.
The Democratic lawmakers who are introducing this package of 6 new bills say the goal is to disrupt bias in the care cycle. Representative Sheila Stubbs of Madison was joined by Senator LaTanya Johnson of Milwaukee, who says for her this is personal.
I ended up giving birth to my daughter 3 days shy of 32 weeks. She was 3 pounds, 15 ounces, and had to be in the neonatal ward. I know what it's like to go home without your baby, to worry about your child, and to pray as hard as you possibly can just for that baby to be able to make it.
Black babies in Milwaukee are 3 times more likely to die before their first birthday when compared to white babies. It's stunning data from the Wisconsin Department of Health Services, and it's remained largely unchanged for decades. Mothers of color do not escape the harsh reality of inequity. According to the CDC, out of every 100,000 births, 42 black mothers will die. When it comes to white women, that number drops sharply to 13.
Wisconsin is ranked one of the worst states in our nation for the maternal and health outcomes, and the worst for racial disparities and infant mortality. Wisconsin is the worst place to raise a black family.
These lawmakers and those who work in the childbirth arena say access to quality and equitable maternity care is critical to meaningful change.
Only because black women or women of color, like their voices aren't heard. So when they go to their doctor's appointments and stuff, it's kind of dismissed. So the same symptoms and pain that like a white woman kind of will endure, the black woman is kind of like not seen as if that's really happening.
Raven Wilson is a Milwaukee area doula who believes helping people understand how doulas improve the health of mothers and babies and providing them access is key. One role a doula can play is acting as an advocate for the mother and baby to help prevent any complications.
State insurance is not covered for doulas. Home births and, through midwifery care, yes, but that would be the next step as well, is just having insurances start to cover doulas, because we want to break financial barriers as well.
Both Representative Stubbs and Senator Johnson call this package a significant step forward in changing policy and systems for mothers and babies of color in Wisconsin. Reporting in Milwaukee, Andrea Albers, TMJ4 News.
And here are some things that Milwaukee African American Breastfeeding Network says you can do to support birth equity issues. Help connect pregnant mothers to community resources. Ask your elected officials to support legislation that supports doulas. Call your insurance company to request coverage for doula services. Or you could also call local hospitals and ask that they allow doula-assisted births.